You are watching AYV Television.
Yes, good morning Freetown, good morning Sierra Leone, good morning and welcome to Wake Up Sierra Leone on AYV Television. We're also on Radio FM 101.7. My name is Bokari Matia. Whether you're watching or listening to us from the provinces or in the capital city on Channel 33 or on DSTV Channel 399 or from across Africa, you're welcome. You can also watch us from around the world on this great day, the third day of the month of June 2026. Please stay with us because in the next 2 hours, we'll bring you news, views, and sports. We're broadcasting live from the top of Tar Hill in the beautiful heart of the city, Freetown. And of course, you can send us your thoughts and your comments to our socials on AYV News Facebook page on the stories that we'll be covering here this morning. And talking on the stories that we'll be covering here this morning, the country's Minister of Health, Dr. Austin Demby, will be speaking on Sierra Leone's preparedness if Ebola returns, while also we'll be discussing the current state of the country's healthcare system, amongst other things. And also, today in the program, we shall be discussing the importance of World Bicycle Day, as cycling offers a zero-emission alternative to vehicle traffic, which helps reduce carbon footprint and improves local air quality in busy metropolitan areas like Freetown. And of course, Care Sierra Leone organizes specialized emergency response training for doctors and nurses aimed at strengthening their ability to rapidly identify and manage life-threatening conditions. But before all this morning, let's take a quick commercial break from our key sponsor, Local Commercial Bank, and other advertisers. We shall be right back.
More and more people are using Rocal SIM Copper Plus in their everyday lives. Did you hear that? She just transferred money for her daughter's school fees. And this man just paid for some products. Ah, Mr. Abu, are you sending money to your wife again?
Yes, like a Rocal SIM couple.
Ah.
Yes, like having money in my pocket.
Ah, excellent.
Thank you.
He just bought some eggs. The world is digital, so keep up with the times. Have you got a payment to make? If so, just download Rocal SIM Copper Plus now. You can download the Rocal SIM Copper Plus app from Apple iStore and iPad or Google Play Store for Android users. You see, it's fast, safe, and reliable.
Sorry, car, go see some business partners.
You didn't give me my money, Michael. Can if I kiss a young, give me this car, people in, not to Indy. Michael, today you pay me my money. I don't send it for let you help me send money in Ghana. 2 weeks now, you not send me money and then you not give me back my money. Today, give me my money.
You know, ever sabi goodness in life. I send back your money, but trust me, today na the very last day I ever send money for now.
I don't need your help because I don't know so with Afri money. I dey able to send money. Now Baku Africa countries them with Afri money. We dey able to send money to over 10 African countries, whether it's Ghana, Gambia, Liberia, or Kenya. If me party we know this, We not follow the body glamour right now.
Okay, una go regret. I mean, now me not. Una go regret.
The best part right now, Michael, with free money, you dey able send money, even if you not use app, even if you not the online, directly. All you need for do, you just dial *161#. Pam, your money don't go. So I don't need the help again. Thief man.
Thank you.
Send money to over 10 African countries instantly with AfriMoney. No stress, no excuses. Just dial *161*1*6# now. AfriMoney, quick and easy.
Good to see your face again. It's been a very crazy day. The joyous feeling in the air when rain falls on a sunny day.
Happy, yeah. Let the stars, let the roll.
Enjoy life's little pleasures with Maltina. Maltina. Share happiness.
As mama, I always want waiting best for me picking them, especially when it comes out waiting them for eat and drink. Now this make I always they choose Sierra juice because they make come from with local foods them and nutritious and it gets less sugar than the other drinks them. Not to me say so.
We lab test show say Sierra juice gets 50% less sugar than the other drinks them na the market.
Because we mama they know waiting best for we picking them, now you make we always they choose Sierra juice. Sierra juice and nutritious, a healthy and it's sweet. Sierra juice, not the taste of Salome.
Fellow Sierra Leoneans, on 8th August 2024, Statutory Instrument Number 8 of 2024 regarding the conduct of nationwide population and housing census was successfully laid in Parliament. On 29th August 2024, this statutory instrument became effective following 21 days from its laying. Therefore, in line with the decennial census calendar, I am pleased to announce that my government will conduct a nationwide population and housing census.
It's 2026, we dey get with census. Make all man tell him fambulem, responsibility for bring development. Make all man tell him fambulem. From the east to the west, blah blah blah. From the north to the south, blah blah. No matter how you dare or you try, blah blah blah. Mama or papa, blah blah blah. One pikin or grandpa, blah blah blah. Auntie or uncle, blah blah blah. Let them come to you. One people, one nation. Let them come to you.
can join the census. Salon now we on.
Okay, well, show me your name, show me your address. For make you go join the plan, the census go make you get the access. For make you go vote now this land, let the all you. If you don't want make them country again, make them creep you. Cause this time you're salon for right.
See what you been a second cabo aduo. We bring good news, salon people every year. Census don't come again. We ready for contact, sky from the young to the old. Say the census go help make development day. Allow me then continue till you know go pay. It go air plan, more schools, hospital and light, even water for you community. Who say you there?
They come to you, yeah. One people, one nation. They come to you, yeah. Now we number go build salon. They come to you, yeah. No person say you not here. They come to you, yeah. They don't come to you, yeah. Census they come, the other we cooperate. Tell mama and papa, then get for country all, yeah, make we all ready. Census go help for make we know we serve, and who say we stand. If you claim say you love salon, who say development day, na day you for day.
Yeah, Motagina, Mingo Tete Biambe, Ka 2026. Census na me right, census na you right. Family. Imagine if they count everybody, they left you out.
Amulemba kotumobawa, upoka kufuninge sagbele tuwa. Tonya, ye amubuji hule panda. Wabulo letebe bawa baya ganga. Ye tumubawa mudagbe behave. Kometi ya kuo salon bate mukeleva. Nyabi yina na metebe bawana. Yo mama kome kolabo ganya delega. Ina.
Kakotone dim din dang, dim din dang, dim din dang. Katap kata tinga be kata konkel, be kata panganda yer. Abageto baget, aindo kor. Akalene, samojamu, agatkamu, sarentamu. Donye, mama marita kangontu.
Ame ya timi wandi, timi wandi. Ame ya timi wandi, timi wandi. Mwa kongo tami wandi, ungewa menda milwena wo. Ya kongo tabi wandi, ungeba handa bebe holo.
From the east to the west, blama blama. From the north to the south, blama. No matter how you dare or you try, blama blama. You want to go, mama or papa, blama blama. One picking on grandpa, blama blama. Auntie or uncle, blama blama. Motivo, may they come to you, yeah. One people, one nation, may they come to you, yeah. Now we number go build salon, may they come to you, yeah. No person say you not here, may they come to you, yeah. May they come to you, yeah.
More and more people are using Rokel SIM Copper Plus in their everyday lives. Did you hear that? She just transferred money for her daughter's school fees. And this man just paid for some products. Ah, Mr. Abu, are you sending money to your wife again?
Yes, like a Rokel SIM couple.
Ah.
Yes, like having money in my pocket.
Ah, excellent.
Thank you.
He just bought some eggs. The world is digital, so keep up with the times. Have you got a payment to make? If so, just download Rokel SIM Copper Plus now.
You can download the Rokel SIM Couple Plus app from Apple iStore and iPad or Google Play Store for Android users.
You see, it's fast, safe, and reliable.
Yes, welcome back. A quick reminder, this is Wake Up Sierra Leone on AYV TV and radio here in Freetown, Sierra Leone. Now, concerns over delays in emergency medical response and preventable death in health facilities have prompted renewed calls for improved preparedness among healthcare workers. Despite significant progress in Sierra Leone's health sector over the past decade, health experts say many emergency cases still result in avoidable complications and deaths when critical warning signs are not identified and managed quickly enough. To help address these challenges, Healthcare Sierra Leone has organized specialized emergency response training for doctors and nurses aimed at strengthening their ability to rapidly identify and manage life-threatening conditions. Eddie Maconte has the report.
Health experts say delayed recognition and response to critical conditions continue to contribute to preventable death in many healthcare settings across Sierra Leone. While the country has made notable gains in reducing maternal mortality and improving access to healthcare services, quality emergency care remains a challenge, particularly in high-pressure situations where every second counts. According to recent health data, a significant proportion of maternal and emergency-related deaths occur within health facilities, underscoring the need for stronger clinical response systems and continuous professional development for frontline health workers. To help bridge this gap, Healthcare Sierra Leone has brought together doctors and nurses for intensive emergency response training, designed to sharpen their ability and identify warning signs, make timely clinical decisions, and provide life-saving interventions.
Our goal has been to first visit all the districts in this country, and after these visitations, giving medication to people who are sick and cannot afford to buy medication, we saw that there is a very big gap in healthcare delivery system, especially what happens to people initially when they have an incident. That is, how can they provide CPR so that they can sustain that person until a healthcare provider arrives. So we decided to start initiating CPR, BLS, and ACLS, and also trauma training in this country.
Consultant anesthetist participating in the program explains why emergency response gaps exist and highlights the importance of continuous professional training to ensure healthcare workers remain alert, confident, and equipped to respond effectively during critical situations. Medical experts say ongoing capacity building initiatives are essential, particularly in a country where health facilities often operate under significant pressure and resource constraints. Studies have shown that many preventable death can be averted through early detection, rapid intervention, and adherence to established emergency care protocols.
There is so much to be taught in 3 years. If you're looking at nurses, there's so much to be taught in 3 years. And when it comes to emergency medicine is a specialized bit of medicine. So you find nurses now who are going on to do their Bachelor of Science in nursing. They are now specializing, So that is where the gap comes from, I would say, by and large.
For participants, the training comes at a crucial time. Doctors and nurses attending the program say the practical sessions are enhancing their confidence in managing emergencies and improving patient outcomes. They believe the skills acquired will not only strengthen individual performance, but also contribute to more efficient and coordinated responses within health facilities across the country.
Much needed, because these are courses that we've not been doing in our country. So having the Healthcare Sierra Leone coming to train us, I think that will help us to reduce mortality in the emergencies that come to our hospital and also in the community.
As Sierra Leone continues efforts to strengthen its healthcare system, stakeholders believe investing in emergency response training for health workers is a critical step towards reducing preventable death and improving the quality of care delivered to patients nationwide. Recent studies indicate that although maternal mortality has declined substantially over the past 2 decades, many deaths linked to hemorrhage, sepsis, and other emergencies remain preventable when healthcare workers have the training, tools, and support needed to act swiftly. For health advocates, building a resilient and highly skilled workforce remains one of the most effective ways to save lives and strengthen public confidence in healthcare system. Edima Conte, AYV News, Freetown.
Many thanks to our reporter Edima Conte for that health report. Well, still in health, in 2014, Ebola entered Sierra Leone through the eastern part of the country, changing lives forever. What started in Kailahun soon spread across the nation, forcing schools, offices, markets, and communities into fear and isolation. More than 14,000 reported cases were recorded, with over 3,500 deaths, and making Sierra Leone one of the hardest hit countries during the deadly Ebola outbreak. The virus claimed the lives of ordinary citizens, healthcare workers, and our national hero, Dr. Sheikh Umar Khan, who died while treating patients in Kenema. From quarantine homes to empty streets to chlorine hand-washing buckets at every gate, and the phrase, "don't touch," became a painful reminder of a nation in crisis. Today, as Ebola concerns rise again in the Democratic Republic of Congo, Sierra Leoneans are once again asking, how prepared are we if Ebola returns? So this morning, to answer this question, including the current state of the country's healthcare system, we have in our studios the country's Minister of Health, Dr. Austin Demby. Good morning, Doctor, and welcome to AYV.
Good morning. Glad to be here.
Doc, let's start off with, how prepared are we if Ebola were to break again in Sierra Leone? What specific systems are in place today that didn't exist 2014?
Well, one of the big lessons we learned from 2014 is for you to be ready and to respond effectively to an Ebola outbreak, it takes all of society. It's all of society engagement. So there's an active part that the health sector plays, but an equally important role that the public plays. I think for us, in terms of readiness, the medical sector is very ready, and I think what we want to do is to ensure that we prepare the public to be very strong partners with us. So I think the readiness level is fairly high. We have a good lead or head start ahead of this outbreak because clearly it's happening in Uganda now and in DR Congo. And these are places that are familiar with these outbreaks. They've dealt with it multiple times on multiple occasions. I think the problem there was it was detected late. It's simmering within the population before they noticed it, nearly 2 months or so of lag time. And so now they're scrambling to respond to it. So for us, we want to learn from the lessons to be able to detect early if it comes here. First, to deny access to the virus, and then be sure that we're able to detect it early if it shows up and be able to contain it. So we're fairly ready, and I think we urge the public to join the medical sector in enhancing that readiness. We're as ready as the last person in the village or in the community that sees something unusual is able to alert the health sector to respond appropriately.
Mr. Minister, if an Ebola case were to be detected today, let's say anywhere within the borders of Sierra Leone, what will happen within the first 24 hours? How will the preparedness look like?
First, you have to anticipate. So I think we're lucky because what we learned from 2014 and 2015 is that we didn't have an institution that's dedicated to this, an institutional home for this. Now we have the National Public Health Agency, whose mandate is to prevent, prepare for, and respond adequately for it. So if you were to have a case show up here, the first thing is we anticipate where this case is going to come from. Because the situation is occurring in the DR Congo, it's unlikely that somebody will drive from or take a bus from DR Congo to arrive here. It's very likely that they will fly into here. So one of the areas of vulnerability is the airport, Lunge Airport. So we're putting in all of the systems in place, including electronic register to allow people to register in advance, so we inquire about them, who they are and where they've been. We have active surveillance on the spot with infrared cameras and thermometers and very trained staff to be able to look and detect any staff that might come in there. We also know that some people, to come into Sierra Leone, they take the indirect route of going to Conakry first and coming by boat. And so we're making sure that the sea lanes are very closely monitored, especially around the landing port at Seabird and Sea Coach. We're also looking at Balamuya, the road access here. We're also working with the Liberian counterparts to ensure that we coordinate our efforts between Liberia and Sierra Leone. So all three countries are highly alert. If a case were to show up here, first we look out for it. If we detect it, we have systems in place to actually sequester that patient fairly quickly around the Lunge access. If it's in town, we have designated sites. Right now, 34 is the main site that we're looking at. We have other sites where we have isolation capabilities. If it were to occur anywhere in the country that has bypassed all of the surveillance stations that we have, each of the hospitals have an isolation ward that's been set aside. We have the requisite equipment and supplies of PPEs and preventive gear. We have 7 labs with capabilities, with primers that are looking for not only Ebola Zaire, but even the new strain of Ebola and other hemorrhagic fevers. We have trained staff. We need to upgrade the training and support the training efforts. We're doing simulations all along. Now is the time to be able to bring all of the simulations to reality. So we're relatively prepared. You know, I think we're ready for this. All we need now is to have very, very strong public coordination, public participation in this to look at early detection. We have an active 117 number. We're asking people, if you see anything suspicious, if you have anything suspicious, don't touch the patient. What you're looking for are clinical signs that includes fever, headache, myalgia, muscle pain, and that's the first phase. It will transition into a second phase, which is a wet phase that includes vomiting and diarrhea, and it gets into a third phase where there's bleeding. Bleeding in the nose, bleeding in the ears, bleeding in the eyes, bleeding under the skin. So if you see any of these signs, in the early signs, the middle sign, or the late sign, call the 117 number. Experts who are there manning the stations, no matter where you are, will be able to deploy the most effective ambulance system to go out there and retrieve the patient and be able to manage the patient for the patient's care. The quicker we could do that, the better it is for the health of the patient. When we extract this patient from a household, we're able to work with the other people within the household to prevent transmission and make sure that if any transmission did occur, that we arrest it before it goes to the next level.
Mr. Minister, help us understand, why are we really on the high alert? I mean, one will think, you know, to say that on a crow fly, there are at least 8 to 10 countries between Sierra Leone and the Democratic Republic of Congo or Uganda. Why is it only us on the high alert? And we're talking about a virus that we've dealt with in 2014, an outbreak now in DR Congo and Uganda, very far off from Sierra Leone. Why are we going through all this, you know, preparation? Are we expecting it?
I think that's a good question to ask. I know that's not a question you are asking. That's a question that the general public is asking. Because what happens is, with current communications capabilities, I could jump on a plane today, now, and be here in Sierra Leone by about 5:30 in the afternoon. I mean, there are direct flights from DR Congo, from Uganda to Addis. There's a direct flight from Addis to Freetown. And so it's easy for people to move around. So it's not just Sierra Leone that's ready. a lot of the countries, because WHO announced this because of the movement of the virus from DR Congo into Uganda, they proclaimed this an emergency of public health concern, of international concern. So all of the countries, not just Sierra Leone, are looking at their readiness. And so it's not just us. I think for us, because of what we went through in 2014, 2015, there is a much, much more heightened alertness around this, and I think that's why you're seeing this kind of reaction. But it's expected, and we don't anticipate this is coming here, but I told you our objective is threefold. First, to deny access, to make sure that it doesn't come here. So that's the systems that we're putting in place. And the next is, if it does arrive here, we identify it quickly and contain it. And thirdly, we prevent secondary or tertiary transmission.
Currently around the world, soliciting funds for health-related issues are constrained. And we're talking about a virus that stretched us, not only, human resource-wise, but also financially. We had to rely heavily on aid. Do we have the finances? Are we ready financially?
So what you don't have in finances, you make up for in preparedness. It's better to prevent this than to try to fight it when it arrives. So we're investing all of our resources into prevention. What you also have is a situation with the difficult financial constraints that are around. Everybody is dealing with their own problems. So we have to deal with our own problems. So we have to bring in efficiencies and effectiveness. There is no known treatment for this virus. There is no known vaccine for this virus. So there's no known cure. But if you have an illness like this, if we detect it early, you're able to manage diarrheal diseases, you're able to manage the fever, you're able to manage the dehydration, you're able to manage the nutrition, you're able to prevent secondary infections, and the chances of survival are extremely high for healthy people who get infected. So the magic here is not how much you have, but the little you have, you deploy it early enough to prevent infections coming in. The government of Sierra Leone has set aside some funding to support the National Public Health Agency. So we have some basic funding, and we've been using this for simulations, for training, for preparedness. We will need to ask for some additional resources for the response. And the earlier we get those resources, the better. So we're in negotiations with the Ministry of Finance to help us out. We're also looking at globally, because if something happens here in Sierra Leone, it's not just a Sierra Leone issue alone, it's a global issue. So the pandemic fund is one fund that has been set aside globally to allow countries to look at preparedness and response. We were able to attract about $20 million from the pandemic fund. Unfortunately, the money didn't come to the government of Sierra Leone. It went to implementing partners, which included the World Bank, FAO, and WHO. So now we're leaning onto FAO, WHO, and the World Bank to help provide some of the resources, even as we ask the government of Sierra Leone to put some resources in there. Again, it's better to prevent it than to try to deal with it when it gets here. So that's why the little money we have, we're focusing on prevention.
You spoke about, training. What percentage of health workers have received Ebola refresher training currently? And then are there enough or sufficient stock of PPEs, or existing supplies that would help us fight, if ever, there are concerns of Ebola? I'm asking because we were overwhelmed the last time in 2014. We basically, the healthcare system didn't understand. The close we got to understanding what Ebola is was the Lassa fever that we had. But how prepared are we now if we have similar incidents?
So, the U.S. had about a few cases and nearly shut down the U.S. So it's not, we really cannot blame Sierra Leone for the kind of response that we had. Any country that will have 100 cases, 200 cases, in our case 4,000 cases, any country will be overwhelmed by that. But I think what we've done since then is to look at this preparedness component of our response. What we've done is we have field epidemiologists who run into what they call the FETP program, Field Epidemiologist Training Program, that have been trained. We have over 300 of them that have been trained, and these are embedded in the primary healthcare system. So 2 weeks ago, I was in Geneva, and there was a special session where people were praising Sierra Leone for being foresighted in this regard. These field epidemiologists are embedded in our primary healthcare system. They help on the quiet days working with malaria, TB, HIV, and what they're doing is paying attention to the numbers. When there is any spike, when there's any movement in the numbers in the wrong direction, they have tripwires that will alert the system. They will call the NPHA centrally to say, hey, we have an unusual number of measles cases. I think this was announced just a few weeks ago. Or we have an unusual number of these cases there. The NPHA now will send a rapid response team to go out and work with the local district team to contain the outbreak. You could manage 20 cases, 10 cases. When it gets to 100 or 1,000, it's extremely difficult. So in terms of readiness, you know, the FETP is there constantly ready with tripwires. At the same time, we've trained a lot of the healthcare workers to recognize Ebola and a lot of these hemorrhagic fevers, not only to recognize it, but to know what to do with them. We know, as I said, the signs and symptoms are initially there's fever that looks like anything else. It goes on to wetness, which is vomiting and diarrheal diseases. It goes on to the final stage, which is the hemorrhage. So people are aware of that, and we have to constantly remind them of it. You know, and knowing that if you see such a case, just call the 117 number, and we'll have rapid response to you to be able to shut it down wherever we see it.
Another thing again that threatened the fight against Ebola in 2014 was the issue of misinformation and fake news. And we saw a glimpse of that, you know, when the ministry announced its preparedness. A certain popular individual was very confident on Facebook to say that, in fact, Ebola is in Liberia and we should be prepared. Is the ministry also prepared when it comes to communications?
I think this is a very difficult space. You know, it was bad in 2014. It's worse now. With social media and the penetration of social media and access, people will sit down and concoct stories, and it's easier to believe these stories than to believe the fact. So, again, that was a very sad incident. It emanated in Liberia, and where a nurse went and said, oh, you know, 5 cases that just showed up. And it took forever for Liberia to counter this because, again, people want to hear bad news. But when this was discovered, I think this lady was chastised, she was arrested and all that. And then somebody else in the Sierra Leonean community who has a lot of followers just propagated this verbatim, confidently. And so we had to, I mean, there was a press release that was put out there, and it takes a lot of effort to counter these negative stories. So we need to caution people to just be careful about what you hear. And that's why we've stood up the National Public Health Agency. That's why we're trying to have the public have confidence and trust in the Ministry of Health and the National Public Health Agency. And when issues come up around these public health alerts and epidemics, listen to the Ministry of Health, listen to the National Public Health Agency as your reliable source. Again, it's a challenge, but we just out of an abundance of caution, the National Public Health Agency and the Ministry of Health, we anticipate false news, we anticipate rumors, but we would rather overreact than underreact. So we respond to every rumor, we investigate every rumor, we investigate any story that comes out because you don't know which one will be the right one or the wrong one. But I think as a population we could help each other by being able to filter this and go to the source of information, which is the National Public Health Agency and the Ministry of Health, as your reliable source. We're strengthening the website of the Ministry of Health. We're strengthening the website of the National Public Health Agency. We're trying to have a network that will allow us to push information to text messages, be able to inform people appropriately. But it's a very challenging switch, not just for Sierra Leone, but all over the world, and it's a distraction. Energy that should be going into prevention and response is going into addressing rumors, in a lot of cases, false messaging.
Mr. Minister, looking at the recent border concerns between Guinea and Sierra Leone, between Guinea and Liberia, in fact, as recent as last week, there were suggestions that the Guinean authorities closed, their part of the border with Liberia because they had local council elections ongoing. Does Sierra Leone still maintain an active border health surveillance system with Guinea and with Liberia?
So this is what we call health diplomacy. In health diplomacy, even in the DR Congo with the fighting forces, when it comes to matters of health, it's easier to talk to each other. It's a common space. About a couple of weeks ago, we held the ECOWAS Health Ministers Conference here. The Minister of Health of Guinea drove by road to come and join us here. The Minister of Health of Liberia drove by road to come and join us here. We constantly communicate. We constantly talk to each other. The border health people talk to their counterparts because, quite frankly, a lot of people on the Sierra Leone side of the Sierra Leone-Liberia border interact more with the Liberians than they are with Freetown. Similarly, the Liberians on the Liberian side of the Sierra Leone-Liberia border talk a lot more with their counterparts here than they do with Monrovia. The same thing with Guinea. If you go to Gekedu and Zerikore, they have a lot more contact with Kailao than they do with Conakry. Similarly, in Pamalap and all of these areas, they have a lot more contact with their counterparts. The hospital that we opened in Kona, I mean, just every day you have people coming from Guinea and Liberia for services. So health is a space where we use it as an opportunity to collaborate. We use it as an opportunity to work with each other because these bugs don't know borders, don't need a visa to cross from one country to the other. So it's incumbent on us to have systems in place, collaboration networks that allows us to work with each other. And the good thing for us around health diplomacy is you strengthen the diplomacy and the trust during quiet times when nothing is happening. You go visit each other, you talk to each other, you take care of your malarias, you take care of your typhoids, so that if you have a situation with Lassa fever, you have a situation with Ebola or any of the exotic diseases, if you engage, it's a lot easier and a lot more collaborative. So it's not perfect, but it's something we're working on.
Away from the Ebola preparedness, let's take a look quickly at the healthcare workforce. Well, there is a problem. Sierra Leone continues to lose health professionals to migration. How severe is the brain drain crisis in the health sector? And how many doctors currently serve the Sierra Leonean population?
The brain drain issue is not a Sierra Leonean problem. It's a global problem. You have a situation where, for example, in the medical school here, in the medical school in a lot of countries, most of the students are fully funded by host governments, fully support them. And upon graduation, the West is offering much better wages, much better conditions, and people move there. And so what we try to do is to look at incentives that will bring people back. Look at incentives that will allow people to stay. Look at the training component. So for us now what we're doing is a cycle of looking at what is needed here, what kind of training do we provide, how do we distribute people post-training, and how do we work on retaining them. So in the medical space here, Commerce is the principal institution for training our doctors. They've trained several thousand doctors, but only a small percentage of them stayed behind. But I think right now what we're doing is two things. First, we feel the need to increase the supply side of it. So that's why, in fact, we're helping to build a new $3.5 million science building at Dewey for the medical students, so that it will go from hosting 100 students to 1,000 students within the physical space. So not only that, we're looking at, after their training, ensuring that we have a home for them. That's why we're building new hospitals, we're equipping new hospitals, we're spreading them throughout the country. So we're not only looking at the number of trained, we're looking at the quality of the training, we're looking at ensuring that they're distributed appropriately and they're retained in the services. Your retention is an index of how much funding you have, how much salary you have, but over and beyond that is what opportunities and privileges you have to practice the art that you have. So that's why we bought like these 2 CT scans here, the high-end CT scans that's available at Connaught. I mean, the other day I went to go do a CT scan at one of the hospitals here, and I saw that it was a 64-cut CT scan. We have a 128-cut CT scan at Connaught in a public facility. When I got here, we were training about 30 to 50 doctors a year. I remember my brother and colleague, Professor Alpha Uri, who was then the Minister of Health, you know, I challenged him at one of the graduations that if you're training 30 to 50 doctors and we need 5,000 practicing doctors here, it'll take 100 years for us to be able to meet that number, provided nobody is sick or nobody retires. We joked about it, but he said we will commit to increasing the numbers. So now we've moved from 30 to 50. Now we're looking at 200 to 300 students graduating per year. So the issue now is how do we ensure that they have a landing zone post-graduation? That's what we're working on. For the young doctors who qualify, in the past they will go overseas for their postgraduate training and their postgraduate residency programs. A lot of them don't come back. Now we've instituted, I mean, the President has commissioned the Postgraduate School of Medicine and Surgery, the Postgraduate School of Nursing, the Postgraduate School of Pharmacy, and now we have residents here who are training to be specialists. Right now we have 150 doctors in different stages of their training to be specialists. And as we're doing that, we're building a new hospital at Carytown, a 300-bed hospital at Carytown. We're building a 100-bed hospital in Moyamba. We're building a 100-bed hospital in Pujaon. We're building a 100-bed hospital in Carine. You saw the Julius Malabio Pediatric Center of Excellence that the President commissioned for 166 beds for top-notch pediatric care. In Connaught, we have the new Center of Excellence, the Maternal Center of Excellence that has 166 beds. It's expanded to the whole hospital now, which is a big medical campus in the middle of Koidu. That's a 400-bed facility. They're going to be doing postgraduate training services there. So it's not just going to be in Freetown. People will be going out to the provinces to not only acquire knowledge, but to also deliver services. Mm-hmm. So we hope to modulate the brain drain by providing incentives and providing opportunities here, providing services here. Last night we were in the office till like 8:30, 9 o'clock at night, looking at ways to bring in equipment and supplies. Now we're looking at buying 500 ultrasound devices that people could use so that even in a remote area, you're able to examine pregnant women or trauma cases and be able to have judgment. Some of these are AI enhanced. So all of these things are going on as incentives. We're working with the government to ensure that the salaries are reconsidered. But even as we wait for salaries, we're looking at other packages. For example, we just got the President just commissioned 10 buses for medical staff to be able to move them around. Again, we're buying high-end. We have like 10 major ultrasound, some of them 4D imaging equipment that's been spread throughout the country. We're upgrading all of the district hospitals, as we say, and hope all of these are incentives that will inspire people to stay. And much more important than that, the incentives to go away are much higher and much more attractive. But who is going to build a healthcare system if we all walk away from it? We don't expect people to come from Nigeria or people to come from Europe, to come from everywhere to come and build it for us. Difficult as it is, we have to be able to invest here and make it grow for us.
Mr. Minister, many healthcare workers still complain about working conditions, and I think very recently we had concerns from junior doctors. What is being done to address some of these concerns?
Okay, so there's several issues. Let's talk about just the general side of it. We talked about the health financing. Health financing is a major crisis situation in the world, especially in developing countries. A lot of the international donors, partners, including the US government, including the Europeans, are either reducing or shutting down their funding, not because of the impact of the funding, but more because of their own domestic crisis that they're dealing with. I mean, for example, the UK is shutting down its funding by October. Yeah. So with all of this, we have major challenges with funding. At the same time, the government of Sierra Leone expends about 11.7% during the peak times on health services. 11.7% of the whole country's economy. That number has gone down a little bit. We're still trying to raise it a little bit. So 11.7%, that's a large proportion. But you know what? 75% of that money is going to pay salaries and wages. 75%. So it's only 25% that's remaining now to buy drugs, to build hospitals, to do all of these services. So again, if you ask for more money, yeah, if you use the existing envelope and expand it for more money, you have a lot less money to buy drugs, to buy all of the services as you satisfy the wage bill. So what needs to happen is the economy needs to grow. As the economy grows, there becomes additional opportunities for that 11% to be extremely meaningful. So what we're also trying to do with the reduction of external funding for the health services, we're looking at new creative ways of raising money. Because if everybody is leaving, if everybody's shutting down, not only in Sierra Leone, but throughout the world, and they're saying countries need to pay for the health of their own people, we're looking at creative ways of raising revenue. One of that is the health insurance scheme that we're looking at. That's fairly advanced. It turns out the free health care is intended for a certain group of people: pregnant women, lactating mothers, vulnerable children, Ebola survivors. But you and I don't qualify for free health care. Yeah? So how do you pay for that free health care? So what we're trying to do is to create this health insurance where we could pool the risk. We put small amount of money together for the whole country, such that if any one of us is sick, you're able to fund that illness. Not all of us will be sick at the same time. So health insurance is a major component. It's fairly mature. We're getting ready to launch that fairly soon. We're also looking at other sources of revenue. One of the drivers of chronic diseases, of non-communicable chronic diseases like hepatitis, diabetes, cancers, there are things that cause it that are lifestyle issues, lifestyle options, cigarettes, or tobacco products, shisha and all of that. All of these lead to very, very major health complications that in the end becomes a burden to the health delivery system. So we're saying if that's the case, then these people who are smoking need to contribute to the healthcare system so that we're able to provide services for them. So we're looking at taxing tobacco and tobacco products. All of this high blood pressure that we have, one of the contributing factors to it is salt. So all of the salt that's you find in all of these products, including Maggi products, Maggi as a brand, but I mean the bouillons that we use, it's monosodium glutamate. It's really bad for your high blood pressure, and we're eating a lot of that. So reduce the consumption of it by taxing it a little bit more. And we're looking at alcohol. Alcohol is leading to liver cirrhosis, leading to all kinds of health conditions. So we want to be able to tax it as well. Sugar, that is the main cause of diabetes, and now we're looking at carbohydrates and stuff. So let us tax those and raise the revenue, ring fence it, so that it'll go into the health sector. So these kinds of things will raise revenue. And we're looking at people that we owe money. A large proportion of this country's revenue is going into servicing debt. And some of the people that we owe money to, I'm not sure if they need all of that money as desperately as we do. So we'll negotiate with them and say, look, this interest that we're paying for the debt that we owe you that's been owed for the last 15, 20 years, why don't you use the interest to support healthcare in this country? So we're using it to raise domestic revenue, even as the external revenues are drying out, to be able to provide services for our people.
Now, to maternal health care services, we've made significant strides over the past years, but I'm concerned and would like to know what gaps still exist when we talk of maternal health care services in the country.
So we've made tremendous progress, as you rightly say. You know, we're the envy of the continent, of the world, because we had the sharpest drop in maternal mortality in the world. But you know, if you are at this high rate of maternal mortality, which was about 1,300 per 100,000 live births, and the second country to us was about 800. Imagine that gap. So we were at a really, really high rate, where I think the joke around was, this is the worst place to get pregnant, the worst place to deliver. You know. We have changed that narrative by this rapid drop that we have. So we've dropped it from 1,300 to 717 to 540 to 340, 354. This was in 2023. We're waiting for the new numbers to come, but I think the new numbers will still be maybe in the 200s. So from 1,300 to 200 is a sharp drop. But the remaining 200 is going to be extremely difficult. So you need to have some major game changers that will allow us to drop these numbers forward even more. So what we're doing now is multiple steps. First, we've developed this Cumbra app, Press Track. The Press Track is used to identify, have every pregnant woman register, so we have a complete profile of that pregnant woman and the pregnancy. And we stay with that pregnancy all the way to labor and delivery. If you have malaria, we treat the malaria. If you have diabetes, we manage it for you. If you have high blood pressure, we manage it for you. We make sure you sleep on a bed net. So we take it case by case on a granular basis and help move them and ensure that we have the facilities for actual labor and delivery safely. Post-delivery, we want to be sure that the mother is stable, and we then jump onto the baby to ensure that this baby, from 0 months to 60 months, that they're not just surviving, they're thriving. So our whole healthcare system now is redesigned to focus on that, even as we look at healthcare in general. As we speak, we started, the president launched in February 14 in Addis Ababa. He launched the 000 initiative, which is just the envy of the whole continent. The 000 initiative is saying, it's not okay to drop it from 1,300 to 200. We're not happy. We're only happy when you have zero preventable maternal mortality.
Is that possible?
If you've been able to drive from 1,300 to 200, it tells you what's possible. So again, it's a 000, zero preventable maternal deaths, zero preventable child deaths, and 0 those children. I like the question, is it possible? The answer is emphatically yes, depending on what we do. So now what we're doing is, usually what happens is people do all of the processes and hope for a result. We're not doing it that way. We're starting with the target that we want to accomplish. We're not trying to be the average or we're competing with ourselves. We're saying we want zero preventable maternal death. What that means is, for every pregnancy, what is there that we're doing that we didn't do that led to this death? It is completely unacceptable. And so if this happens, we audit, we have a detailed audit to see what didn't we do. Now, if we figure that out, it means, for example, if you have 100 pregnancies and one person dies, you interrogate and see what happened there so that you're able to protect the 99 that's behind. So we're doing this district by district, chiefdom by chiefdom, neighborhood by neighborhood, on a national scale. And that's why we're very, very ambitious, very, very confident that if we combine community engagement, active community engagement, very strong medical engagement, if we do this together, we've shown how you drop it, we could drop it to zero. Very, very confidently. I mean, we're looking at zero-dose children as a good example. With zero-dose children are children who'd never had a vaccine in their life. Yeah? How could you have children in a country where you have vaccines and you have vaccine-preventable diseases? Any child dying of a vaccine-preventable diseases that hasn't been vaccinated, we feel guilty because it's something that we could do that we didn't do. So we're saying in this country, it's zero-dose children. And what we've done, since we launched this program on the 1st of March, I think today is day 94, 95, or we have an app that you could easily check and see what's going on. We're targeting 9,000. The estimates are that about 9,000 children in this country that have never been vaccinated. In the 3 months that we started this program, we've reduced that number by half. We've been able to find over 5,000 children and ensure that they have the vaccination. Now we're looking for the remaining 5,000. So when you say, is it possible? Yes, it is. If we as a nation come together and say we will do this, and we have visible signs that it could be done. It's not a Freetown issue. It's not a Kenema issue. It's not a Bombali or McKinney. It's a whole national issue. Everywhere we're running after this. So in fact, as I finish this Friday, we're going to the country, we're spreading out. We're coming to the 100-day mark. The 100-day mark is an introspection mark. We've been setting all of these systems, and right now we're seeing some telltale signs that it's moving in the right direction. So the first 100 days was setting up. The second 100 days is going to be an intensified effort going for every pregnancy and ensuring that we land it safely.
Mr. Minister, medicine and medical supplies, procurement of medicine. How much of Sierra Leone's medicine supply depend on imports?
100%. We don't manufacture anything here, so we import everything. But what's happening is, this is not just a Sierra Leone issue. The whole continent of Africa imports 95% of all of the products that we use. Yeah. What we're trying to do now, Africa has established the National African Medicines Agency, AMA. Yeah. AMA is helping us in the continent to look at manufacturing practices to see if we're able to manufacture our own products for ourselves. So this is a whole continent-wide effort. There's some big players that are in there that are looking at big manufacturers, vaccines and big medicines, but there's room for everybody. You know, even the bandages we have to import, even the mosquito nets we have to import. So we're looking at how do we organize ourselves to be able to start manufacturing this, have a pool procurement arrangement that will reduce the prices, invest in some of the manufacturing capability. In Sierra Leone, our market is small. You only have about 8 million people, so you can't talk about let's make our own vaccines and all of that, yeah? But what we're looking at, the president has been very instrumental in working to open the market in West Africa. So what we're doing now is to attract people here, to work with our local folks here to look at manufacturing in labeling and distribution, not only in Sierra Leone, but throughout the sub-region. So that's ongoing. Critical to all of this is the regulatory capability. So we're looking at the national regulatory agency here. It's completely overwhelmed because it's doing the management of the pharmacists on the one hand and looking at the regulation at the other hand. So we're trying to separate these and make sure that we could grow from maturity level 1 to maturity level 3, which allows you to be able to authenticate products that have been manufactured in the country and looks at reciprocity between countries like Sierra Leone and other countries who are manufacturing.
Mr. Minister, if we are 100% dependent on the importation of medicine, how does the ministry ensure medicine quality and combat counterfeit drugs, and also the issue of the importation of, drugs that are not allowed to be imported in Sierra Leone? We talk of the tramadol and the likes. How?
Well, you saw the other day that the regulatory agency put a hold on tramadol and restricted it. All of this is in order to manage things that are coming into the country. It is the responsibility of the National Regulatory Agency, the Pharmacy Board. It's constituted properly, it's got its own lab, it's looking at products and verifying products, it's looking at vaccines and making sure that the vaccines are appropriate for us here. All of the things that are coming into the country that are illegal are going under the table, are going around the table, are going over the table. And what we need to do is to engage law enforcement to work closely with the regulatory body to identify these people and work to eliminate it from our midst. I think the other part of it is the public. So we work with the regulatory agency to do their part. We work with the security agencies to join us in apprehending, in preventing. Now they have the situation where at the ports, things are extremely slow. At the airport, things are extremely slow because they have 100% search of everything that's coming in. That's how they're discovering all this tramadol and all these products. So we work with the security agencies to ensure that there are systems in place to monitor. At the same time, as we do that, as we manage the part, it's important that we educate the public, because the public then they go buy then cheap drug, they go buy the fake products. We're trying to ensure, for example, we're looking at public-private partnerships, where within our public hospitals, you have a requisite, sanctioned, regulated pharmacy, private pharmacy, that's operating within the hospital, that's looking at set prices, ensuring that the products are within standards, that they're within dates. And we're encouraging the patients to be able to use these services. At the same time, we're not there yet because there are all kinds of shenanigans going in, and people will rather go buy these products on the street than to buy it in the legitimate facilities. And it has negative connotations for us. It's bad. It's leading to resistance. It's leading to you buying products that you're not even sure what it is. They're constantly raiding the streets now, taking people. As soon as you take them off, the next day they show up again. We're looking at the legislative issues around it and working with the judiciary to look at what kinds of penalties should be in place that are deterrents, rather than having somebody come in and you fine them 5,000 leones. They pay the 5,000 leones and they go back on the streets tomorrow.
Mr. Minister, you've spoken before about the budgetary allocation. Of course, as compared to the benchmark set by ECOWAS, we fall far behind. And also, donor fundings are waning. You've spoken about measures in place to ensure, we pump money into the health sector by ourselves. You just spoke about the insurance policy in place. But then at the end of the day, the health ministry in Sierra Leone cannot be compared to other ministries that generates, enough funding for government. Do we still need more budget pumping into the health sector, or should we go completely private?
So you had some statements that I need to go back and correct. Sierra Leone is doing extremely well in terms of the percentage allocation Most countries are not even up to 3-4%. You know, Nigeria was struggling. What are you saying, 15%? We can't do that. You know, so they're all hovering around the 5-6%. There are only a few countries in Africa that have reached the Abuja Declaration. So we're doing relatively well as a percentage of the contribution to the health sector. What we're short on is the size of our economy. So if you say 11%, 11.7%, or even 8% as we are now, 8% of what? If the economy grows from $1 billion economy to $10 billion, then the 8% is serious money that you could work with. But the economy is growing at a very narrow pace, is restricted. There's a lot of international pressures that are going on that doesn't allow the economy to explode or expand the way it is. So we're happy that we have this 8 to 11.7% allocation to the ministry. We will continue to work hard for more. But again, it's not enough. So what we're looking at is 3 different approaches to healthcare delivery. The first approach is the public approach, where you have the Connaught hospitals, the district hospitals, the PHUs that are government funded as a safety net. We're looking at public-private partnerships where we partner with other institutions who will come in and say, we'll give you the land so that you run the hospital, we'll give you the staff, and we'll work together and make sure that you're able to provide some services for some people at a nominal fee. So you have a lot of the public-private partnerships that are popping up. The third model is private sector hospitals, fully private sector hospitals that are run independently, that are regulated by the Medical Council in Sierra Leone, but they're run privately. They're for profit. For me, the issue now is it's market segmentation. There are few people who could afford it. They will go there and get their high quality service. Yeah? What we're trying to do as a government is to focus on the public service side, try to make the best that we can, stretch the dollars as much as we can, but it's a safety net that will allow everybody to benefit from the public service. And those that could afford it, let them go to the private sector. Again, we have 128 slice CT scan in the public, the first of its kind. Yeah, it's there now at Connaught, but it's for the public.
Is it cost effective?
Now listen now, this is for the public. Yeah, the public, anybody who goes there, they will look at you, they will provide services for you for minimal cost. Now, if you want to go there, and it's costing you a lot of money to go there, but you don't have the patience to go sit down and wait for your turn, you could go to the other private places and pay more money for it and get your services. For us, we're happy with that because it's a market segmentation. You've gone there, so we don't have to worry about you anymore. We'll look for the poorer people who could not afford it. So it's very cost effective because what you're doing is to have minimal costs associated with it, not for profit. We just received about 15 dialysis machines. We have about 5 chairs at Connaught, right? So we're looking to see how do we replace all of those 5 chairs and redeploy the dialysis machines throughout the country, in a lot of the major hubs, and get it there so that people don't have to travel from Kamabai to come to Freetown for their dialysis.
Mr. Minister, how much does the U.S. aid cut impact the health sector?
The U.S. aid cut impacts most countries fairly dramatically. Yeah? It didn't impact Sierra Leone as much because what happened was the bulk of U.S. aid was focused on HIV and AIDS and sexual and reproductive health. But most of it was HIV. It was funded through PEPFAR. So countries like Zambia got $350 million. Kenya got like $500 million. Ethiopia, 500. Rwanda, that kind of number. South Africa, $2 billion. So if you remove that kind of money from them overnight, it is very, very impactful. Sierra Leone, we were getting maybe like $30 million, yeah? So when you remove the $30 million in a country like Sierra Leone, it's very, very impactful. But the method that we're using to allocate these resources was fundamentally not agreeable to us. Because what they did was USAID was the government, the US government's agency that allocated these resources. They never gave money directly to the government. They gave the money to implementing partners and asked implementing partners to come and work in Sierra Leone. And when they came in, we don't know how much they got. We don't know where they worked. We don't know where their focus was. Again, so this wasn't really working for us. So when you say the money was removed, how did it impact? In a lot of cases, we didn't know what the impact was because we didn't know where the money was going. So what's happened now is the US has said, okay, you know what? We're going to stop giving money to all of these countries. Yeah, not only Sierra Leone, all of these countries. They're putting about $56 billion into the global health space. They took all of that out. And then they demolished the USAID that was the government agency that was distributing all of this money. So all of it was shut down. So all of these countries, including all of these major partners who were receiving money, they were up in arms, you know, what are we going to do? You know, including us in Sierra Leone, who said, okay, we didn't see the money, but, you know, you were here. What are we going to do when you're gone? So the U.S. came back and said, okay, by the way, just so you're aware, this money we were giving you is not profit we have. It's borrowed money. We're borrowing money to support your health systems, to support your health. Yeah. We're not going to do that anymore. We will stop. So now listen, when they said we will stop, everybody was like, if you stop now, people are going to die.
Mr. Minister, in areas where the US aid directly impacted, for instance, US is funding the PIH in Kono.
No.
And they're doing a wonderful job. Is that not it?
The U.S. is not funding PIH. Oh, sorry. I'm sorry to your listeners. I'm just a little shocked that you could make a statement like that. No. PIH Partners in Health is a foundation that's looking at one of the co-founders, Paul Farmer, a personal friend of mine. It's a foundation that raises money amongst private donations and friends, whatever. In fact, we were all raising money for them. My daughters raised money.
It's a US-based foundation. One will say they have been receiving US aid and funding.
You want the facts? They're not receiving US aid funding in Sierra Leone. Yeah, in a lot of the cases, they were not receiving. It's a private foundation whose ethos is different from a lot of the other organizations. PIH, their ethos is, Paul Farmer and Jim Kim and others who founded it, their ethos was healthcare should not be based on where you're born or where you are. You should be able to get high quality care no matter where you find yourself. So in Sierra Leone, they've been here for so long. They were here, they came during Ebola. Yeah? They worked in Port Loko for a while. And then they went to Kono. We've been working with them, with the Ministry of Health forever. We raised money together, about $23 to $30 million for the PIH project. The government of Sierra Leone contributed $7 million. Even myself here, I contributed. My daughters contributed to it. So it's not a U.S., in fact, they try to shy away from the U.S. government because they're an independent private foundation. So again, we work very closely with them. They're partners in health. Their partner is the host country.
As we round off, Mr. Minister, I would not let you leave without talking about, another thing that's a concern and a silent killer, cancer.
Yeah.
We have breast cancer for women, prostate for men. Diagnosis is still a concern in Sierra Leone. What plans are there for that? And then I know that Connaught holds a cancer clinic once a week, every Friday. isn't that stretched or overwhelming for the concern we have when it comes to cancer?
Yeah.
Breast cancer for women, prostate for men.
Yeah, there are lots of cancers that we see. Yeah, you have the lung cancers, the breast cancers, the prostate cancer. Cervical cancer is one of the biggest ones in the country. So the things with cancer is you have to have early diagnosis. Yeah. So what we're looking at, let's take cervical cancer as a good example that people are dying of in really large numbers. Cervical cancer, what we've done in Sierra Leone is we're saying we will eliminate cervical cancer in this country. And there's a three-step approach. First, you could prevent infection in the first place by having a vaccine, yeah? The human papillomavirus vaccine, HPV vaccine. So here in this country, we're looking at prevention. We're vaccinating all 10-year-old girls. You know? We started here, the first time we started, we said we will vaccinate 50,000 girls, and people are like, oh, no, they're not going to agree. You know, the first day, the first week that we launched this, we vaccinated 94,000. Yeah. The next time we said, let's expand it a little bit. We set a target of 1 million vaccinations. You know, in 10 days, we vaccinated 1.13 million girls in this country. 10 days. That means 1.13 million girls now are protected for life. So what we're doing is the vaccination is the firewall for people who are coming in at 10 years. So we're trying to integrate that now into routine vaccination. The next step is to look at early diagnosis. Early diagnosis is looking at the changes in the cervix for those that were not vaccinated. You could use it using simple vinegar. And so that's available in a lot of our clinics that will allow you to screen for cervical cancer. And if you detect lesions, small lesions in the beginning, you could either burn it or cool it off and remove it that way. That's the second phase that we're looking at. The third phase is much more advanced cases. They'll need chemotherapy and they'll need radiotherapy. What we're doing now is to build the institutions for chemotherapy and radiotherapy. So the president had secured some funding from the OPEC fund. We've been working on this for quite some time. In fact, even yesterday, we reminded the OPEC fund to move forward with this. We're looking at Carytown. We've identified the site for it. We're looking at, right now, one of the 3 hospitals that's been ready, including the Macaulay Street Hospital, is a 100-bed facility. We're going to convert that as a holding area for cancer management as we build a state-of-the-art linear accelerator over at Carytown. So a national program is going. Again, the issues there is early detection and early treatment. You know, for all of the cancers, including the cancers for men, prostate cancer, you know, if you detect it early, there are things that we could do. If we allow it to go to advance, it will be very, very difficult. So we're looking at the diagnosis and the care.
Quick comments for you as we close on Facebook. Safia to George says, he who feels it knows it. This was the survivor slogan. In this case, I know that my family went through losing 12 of our family members. I'm still appealing to the health ministry and the government to be very alert to alleviate a breakout of this deadly Ebola disease. May God help us. And Swissman is asking, Mr. Minister, he's saying, Mr. Minister, not only people who are smoking should contribute into the medical sector, even those who import tobacco and alcohol should have increased tax so that some of those monies will go to the healthcare sector and contribute to the national problem. Sir Muhammad Ali says, with the people of Sierra Leone, we do not need any disease like Ebola. Let's join hands together and fight and be aware. Mystic from Dwazak says, any disease outbreak is often accompanied by denial and misinformation, especially in an era where social media is widely accessible. In Sierra Leone, many people receive and share information without verifying its accuracy. Therefore, the Ministry of Health should remain proactive and consistent in refuting false information and providing timely, accurate updates to the public. Safia to George says, as a victim and survivor of the outbreak of Ebola, it makes me feel very scary. I'm begging the minister to really keep nurses alert in case we have any victim. I think those are the messages so far.
Yeah.
Your reply to them.
So I think most of them are very complimentary, sounding there a lot. In the Ebola situation, we lost close to 7% of our healthcare staff because they were in the front lines. We lost 10 of our doctors here to Ebola. And I think our solemn promise to the country is never again. We will work with the frontline healthcare workers. For example, even with the Ebola virus, we had the Zaire strain. When you had the outbreak in Guinea in 2021, we were able to secure over 20,000 doses of the Ebola Zaire vaccine strain, and we were able to protect all of our frontline workers. It's the same principle that we will deny access, but if it came here, we'll contain it. One of the things that we did during the Guinea outbreak was to show solidarity. We'll go there and we'll work with the Guineans we went there to work with the Guineans to contain it there. We're offering similar olive branch to the Congolese and the Ugandans, although they know what to do. They really probably wouldn't need our help, but they need our solidarity, our support for them. When there was an outbreak of Marburg in Rwanda, we had 20 Sierra Leonean staff deployed there to help the Rwandans. So we will not take this lightly. We will be alert, we'll be ready for it. But again, as I said early on, this is not a health sector response alone. This is all of society, all of community engagement. On the rumors and the false news issues, we'll strongly advocate for people to desist from that, to just stop forwarding these messages that you cannot verify. Rely on the National Public Health Agency. Rely on the Ministry of Health for communications around these issues. We'll make sure that it's updated regularly. We'll make sure that the information is accessible. We'll make sure the information is in sound bites that will allow people to just forward it, knowing that it's coming from the ministry.
Right, thank you very much, Mr. Minister, for joining us this morning.
Thank you, Mr. Matia. Always a pleasure.
Yes. He's the Minister of Health, Dr. Austin Demby. He's joined us this morning on AYV. Let's take a quick commercial break, and then when we come back, we're going to our second segment of the show.
More and more people are using Rokel SIM Copper Plus in their everyday lives. Did you hear that? She just transferred money for her daughter's school fees. And this man just paid for some products. Ah, Mr. Abu, are you sending money to your wife again?
Yes, like a Rokel SIM couple.
Ah.
Yes, like having money in my pocket.
Ah, excellent.
Thank you.
He just bought some eggs. The world is digital, so keep up with the times. Have you got a payment to make? If so, just download Rokel SIM Copper Plus now.
You can download the Rokel SIM Copper Plus app from Apple iStore and iPad or Google Play Store for Android users.
You see, it's fast, safe, and reliable.
Sanika, go see some business partners.
You didn't give me my money, Michael. Can if I kiss a young, give me this coffee pulling, not to Indy. Michael, today you pay me my money. I don't send it for let you help me send money in Ghana. 2 weeks now, you not send me money and say no, you not give me back my money. Today, give me my money.
You know ever sabi goodness in life. I send back your money, but trust me, today na the very last day I ever send money for now.
I don't need your help because I don't know so with Afri money. I dey able send money. Now Baku Africa countries them.
With Afri money, we able send money to over 10 African countries, whether it's Ghana, Gambia, Liberia, or Kenya.
If me party we know this, we know for the party drama right now.
Okay, una go regret. I mean, now me not. Una go regret.
The best part right now, Michael, with Afri money, you dey able send money, even if you not use app, even if you know the online, directly. All you need for do, you just a dial *161#. Pam, your money don't go. So I don't need the help again. Thief man.
Thank you.
Send money to over 10 African countries instantly with AfriMoney. No stress, no excuses. Just dial *161*1*6# now. AfriMoney, quick and easy.
Yes, welcome back. You're still watching and listening to Wake Up Sierra Leone on AYV television and radio. Don't forget to send in your comments and your thoughts and questions to our Facebook page, AYV News, and be part of the conversation. Well, still on health benefits, let's now turn to cycling. Bicycle in a country where transportation can be very high, the bicycle is vital. Affordable tool that bridges gap between communities and unlocks economic opportunities. For students living in rural villages across Sierra Leone, bicycles dramatically reduces long commute time, making education more accessible. Today, World Bicycle Day in Sierra Leone emphasizes affordable mobility, rural education access, and public health. For citizens, cycling provides an expensive and also an experience alternative to costly public transit. It connects rural students to remote schools, help prevent lifestyle diseases, and promotes sustainable urban development. Cycling also offers a zero-emission alternative to traffic, which helps reduce carbon footprints and improves local air quality in busy metropolitan areas. The World Bicycle Day also acts as a catalyst to advocate for better cycling infrastructure and safe riding conditions for vulnerable cyclists sharing the road. The celebration of the day also started in April 2018, where the United Nations General Assembly declared the 3rd of June every year as World Bicycle Day. The resolution for World Bicycle Day recognizes the uniqueness, longevity, and versatility of the bicycle, which has been in use for 2 centuries, and that it is a simple, affordable, reliable, clean, and environmentally fit, sustainable means of transport. This morning, to discuss the importance of the World Bicycle Day and more, we have in our studios Shedrack Williams. He's the Technical Director of the Sierra Leone National Cycling Association, and Tennyson Dixon, a cyclist. Good morning, gentlemen. Welcome to AYV.
Good morning. Good morning, thank you.
Yes, gentlemen, when we talk of, cycling and bicycle, why should World Bicycle Day matter to the average Sierra Leoneans? I have bike, I have keke. I get me normal bicycle now.
Yeah, I know.
Why is bicycle important?
Very, very important because of bicycle, many health benefits, means of transportation. You understand? That's why in 2018, the United Nations resolution tried to recognize as World Bicycle Day.
Beyond the symbolic celebration, since 2018, June 3rd, what measurable impact has World Bicycle Day had on, the cycling development in Sierra Leone?
Well, it's creates more development because we recognize that day, and that's why I think in every part of Sierra Leone, people are riding bicycles, means of transportations, like going to Lunsabo, you understand, the school going children use bicycle to go to school, which is very good for them, for the health, mentally and physically, benefits.
Shedrack, Sierra Leone's roads are largely designed for vehicles, and the everyday commute or everyday roads, even our highways are designed for vehicles and big trucks.
Sure.
What practical steps are needed to make them bicycle friendly?
Well, yeah, I agree with you, but the thing is, as of now, the awareness is there. People are very conscious of bicycle on the roads. Even with time to time, we always try to organize, a bicycle ride around the town in terms of races, sort of like easy workouts. Even some months back, we do a ride with the chief minister, which we started at Upgon and direct to the beach, which was good. Chief minister and so other ministers were around. So the awareness is there. Always the police are with us.
Have you had any discussion with the Ministry of Transport regarding cycling infrastructure, or even City Council to ensure you have cycling lanes? I know we can't do that within the central business district because we've already planned way beyond. Even our slabs are not done. How much were you able to get space for bicycle?
Sure.
And then there is the attitude problem. People had heard that this is a cycling space. So it's a whole cultural shift or change if we're to go into that. But have you engaged, the relevant authorities and ministries whenever you have, events to ensure your safety?
Yeah, sure. We always do that. Whenever a race is coming up, we involve the police, even the council. I remember we did an event at about 2 years ago, which was the main center of this district, Pademba Road, Cotton Tree, Shaka Stevens Street, Oluwaran Kingama Road, Jomoka Road, which the mayor was also there, which was good. So I think the awareness is there. Just as you are saying, our roads are designed for this or bicycle ride, rider on the streets. That's why, like a long time ago, the time I was taking part in cycling events, because I was also a cyclist. There was a time when one driver gets an issue with one of our guys. Driver just look like we are not serious, we are useless. I think he will never forget that day again. Because the problem was it damaged one of the guy, the back wheel, which cost a lot of money. Take him to the station. I pay a lot of money. At that time was about 1,500. This I'm talking about 15 years ago. A lot of money. So I think he learned a lesson.
Yeah, let me bring in Tennessee. You are a cyclist. How is it like, being a cyclist? What is the life of a cyclist like?
Thank you very much. Being a cyclist is a bit challenging, as well a happy lifestyle. What are these challenges out there? Because just like Mr. Williams was saying, the awareness in this part of the world is not that much, especially with other road users like the drivers and that of the kekes and bike riders. They just think cyclists are just dropouts, being on the road, doing their normal bicycle thing, which is a myth. It's a complete different thing. Most of the cyclists around are well educated. Some of them are even working, and some have family. So being a cyclist is more than just riding a bicycle. It's about giving back to the community, giving young people hope, as well as other people we come in contact with.
Being a cyclist is a very demanding sport. As an athlete, you need more endurance. In fact, people might not understand that you train more than even some footballers.
Yeah.
You know, how is the training routine like to be physically fit as a cyclist?
Well, physical fit, just like you said, endurance, because cycling race normally goes up to 4-5 hours, which is a lot, like 150 kilometers, even 200 kilometers. So you need not only to be physically fit, you also need to be mentally fit. You need to be doing some physical workout apart from riding your bicycle, like some gym, you know, workout, do some extra kind of training, because you don't only have endurance just by riding the bicycle. You can go for some running, which also helps you to get some endurance, some physical workout that helps to strengthen your upper body and your down part as well. So it's a really challenging part, you know.
You know, when we look at areas like football, you know, we have several internationally certified coaches, even in Sierra Leone here. Can we say the same for cycling? Do we have internationally certified, you know, cycling coaches or Sierra Leoneans who are in the position who are internationally certified cycling coaches?
Yes, we have coaches that are, even though they are not many, but we have people that are satisfied and they go through the necessary coaching course and they have their qualification, and they can also give out their experience and teach the boys, you know, in a better way.
And then also there's always the question, if what you're doing pays, does cycling pay?
Well, for me, it pays because it's not all about what you directly get from riding in bicycles. It's about the lives you touch and the people you come in contact with. As for me, through cycling, I've been able to come in contact with different people. Some that even helped me in terms of my education. So it's not always about the money sometimes, even though it's important, but it's also about the relationship you build out there. And cycling is one of the sports that can help you to meet different people. We have tourists that are coming in the country every day, every moment. So we come across those people, and it's a good opportunity as well for us to reach out to them, tell them about Sierra Leone and about the challenges and all the benefits that, you know, cycling has. So it's not all about the money sometimes, the relationship as well.
Sheriak, you coming from the Sierra Leone National Cycling Association.
Yeah.
What are the major gaps that we have in the country when it comes to athlete development? For other sports, again, we'd like to reference football. You know, there is the policy of catching them young. You see, you get under 7, under 12.
Yeah.
How is it like in the cycling world?
As the same, catching them when they are young, but in cycling, it's very challenging because you need finance. That's a big problem because, for example, if you get a boy, a young rider, whether female or male, at the age of, let's say, 10, 12, going to school, you go to his parents, tell them about cycling. They will look at you like you are not serious, because they will want to look at what would be the benefits, and people always think most of the benefit is money. Not all the time it's money. Just like what Mr. Dixon was talking about. Yeah. Cycling, you meet plenty of people and got connections. Yeah, like through cycling, I meet with a lot of people. Yeah, connections.
As the technical director also, there are issues around cycling that, you know, we, or many people do not know or understand. The science aspect. It's not only to get on a bike and run. You know, a sport that is injury prone, you might have an ankle injury or a hamstring, as the case may be, or a groin injury. You know, are there sufficient nutritional or science, sports science support to, this is not even about financing now. Let's talk about it. Are there enough when it comes to the sports?
Well, I could say not well. What would I say? I would say we are trying to put things in place for those things, because like in what we are talking about, some injuries, I believe, because as for me, I'm a qualified coach in cycling, doing course level 1 to 3. So I know what is good for the cyclist in training, even from the younger age, which would not lead you to major injuries. So few of, we're not much on that, but few of us know how to do that.
When we talk of the sport itself, how often do we compete? Regional, African, or international? How often do we compete?
Well, I can say the major, if we have the finances, we want to compete every month, every week. But the finance is the problem.
We've seen, I'm sure that we've seen other countries like Rwanda, for instance, or even Eritrea. They've done exceptionally well in cycling. Are there lessons that Sierra Leone can learn from those countries, you know, that are now becoming powerhouses in terms of cycling in Africa?
Yeah, well, the thing is, our main problem here is those are support, financial support. Because if you have the support, you will do more. Those countries, they have the support financially. Sometimes, even if we want to travel out, we're in serious constraints to travel. Like for the year, there are many competitions around in Africa, but we are not able to compete in every because of the financial support.
Why is that the case? Is it that cycling is not as popular or as important as the other sports?
Well, I think for me, cycling is very, very important and popular. Cycling is popular now because growing up, when you are young, there's two things you want your parents to get you: a ball and a bicycle. So cycling is popular. Just that, well, I would not want to comment on certain things, but I will just say we're just hoping for us to get some support from the government and some donor partners.
All right.
So that we can do more in cycling.
Tanisi, let me bring you in. As a cyclist, how safe do you feel riding on Sierra Leone's road? Do you feel safe at all?
Well, for me, compared to the time I've been in the game, I feel safe actually because I understand most of the road signals and that of the vehicles as well. But for younger guys just coming into cycling, it's not actually safe for them because we have so many reckless drivers around. And if you are not that much attentive and confident as well, you might scared and get off the track and get injured. So for me, I feel safe. And most times, if I'm doing my training, I would go beyond like the peninsula or beyond Waterloo. Those parts are very safe compared to the road, the big enough, you know. So you can be few meters away from the cars and bikes as well. So it's a bit safe for me, although just for the guys coming up, like I said, you know, for their first time or second times, it's not too safe for them, actually.
Another thing again is it is expensive to maintain those bicycles. Very. You know, for people who don't understand, you just if you're seeing a cheap bicycle, it's not cheap. It costs thousands and thousands of dollars. And with the advancement of science and technology into these bicycles, it requires maintenance.
Yes.
Where do you get the funding, to maintain those bicycles? Or how expensive is it to maintain a competitive bicycle in Sierra Leone?
Well, I've been into cycling for over 10 years now. So I came in the time wherein it was very expensive to fix up your bike, because at that time there was not much cycling clubs, and all of the expenditure have to come from your very own self. But now we have clubs, and most of those clubs, they have technical mechanic that are assisting the riders to get their bikes being maintenance. But the challenging part is having the right equipment, because you can have the money, but if you don't have the spares, it's another challenge. So it's still a bottleneck on that particular side, and it's very, very challenging, because you can have the money, but you don't have the spares. So with the introduction of those different clubs into the association, it makes life easier a bit for cyclists, because the money does not have to come directly from their own pocket. Even though you as a cyclist, if you know you want this particular equipment for your bike, you need to go the extra mile to make sure you have it in order to improve your performance.
Before we go over to a story we have on cricket, Shedrack, I'd like to know, is the cycling community doing enough to attract women and girls? I know for the ordinary Sierra Leonean, as soon as you mention cycling, the image that pops up, in the minds of Sierra Leonean would be a male, on top of a bicycle with a water bottle and stuff like that. So is the association doing enough, to attract more women and girls into the sport?
Yeah, we are trying to involve mainly female in the sport. I think for now we're improving.
Now, are you thinking of having any programs, like going to schools, to ensure you attract more people to come?
We are trying to working on that. Sure, definitely.
Okay, but whilst we still have Shedrack and Tennyson with us here in the studio, let's now go over to cricket. Because following a 3-day rigorous entry-level cricket training for over 4,000 schoolgirls in Western Area Urban, Cricket Association Limited organized a competitive and exciting inter-school Creo Cup competition at the King Tom Oval. St. Joseph's Convent Girls Secondary School were crowned champions of the inter-secondary schools, Girls Secondary Schools Creo Cricket Cup competition. Maria Esther Samura has more.
The atmosphere was jubilant as these girls put into practice the skills acquired during their intensive 3-day entry-level cricket training delivered by development officers from Cricket Sierra Leone Limited. The Creo Cup competition targeted 10 girls' schools, 3 primary and 7 secondary in the Western Urban area as part of the Inter-School Creo Cup Festival. But what is the essence of the Creo Cup and how is it played?
Hits the ball, I want to hit the ball. But the only thing that there is a boundary. When he hits the ball, when the ball hits the ground away from the boundary, it's 4. If the ball hits the ground over the boundary, is 6. That means you already score 6 runs without 1 hit. You score 4 runs without 1 hit. Now, of course, to engage children is a difficult task, because the game is an awareness game. We want to enroll more girls into the cricket family, because we have the ones that are here now, they will be run out. Then these ones that are coming, these young ones.
The nationwide initiative aims to boost female participation in the sport and to strengthen cricket popularity across the country, with ambition for it to become Sierra Leone's second most followed sport after football.
Creo Cup is about celebrating women's cricket during the ICC Women's Cricket Week 2026. It is about bringing schoolgirls together, a significant number of them, create fun and inclusivity. We want as many girls as possible to be part of cricket. We want cricket to be part of the culture of majority of Sierra Leoneans. We would also like to increase the number of participants. And one of the ways to increase number of participants is women and girls cricket. So this is about celebrating our girls, celebrating our women. One of the good things that have happened to cricket and a state as a state is women's cricket. Since the introduction of women's cricket in 2008, our heroines have won so many laurels for Sierra Leone. The most recent was in Gaborone, Botswana, where they won a silver in the ICC Women's T20 Cricket World Cup African Division 2 qualifier and secured the qualification to the African finals, and also won the Kubuka Women's T20 International Cricket Tournament. So this is one of the ways we are using to attract as many girls as possible into the game to ensure inclusivity and create fun for them.
At the end of the day, St. Joseph's Secondary School were crowned champions of the Creole Cricket Cup competition in the Western Area Urban category, while the Forum for African Women's Educationalists emerged as champions of the Inter-Primary Girls Schools category. Mariesta Samora.
Many thanks to Mariesta Samora. As we close now, tennising, if a young boy or girl is watching you and he or she has that dream to become a cyclist, what would you tell them?
Well, I would first of all want to encourage them and be part of cycling. It's not only all about riding a bicycle, it's more than just a sport. And like you have already mentioned, some of the benefits in terms of health-wise, mentally, as well as physically. Cycling is a very good sport, and it's a very intelligent sport in terms of data-wise as well, and it's one of the most data-collected sports. So I would encourage them to get a bicycle and be part of cycling. They can reach us at any point in time if they want to join and enjoy the beauty of cycling.
Mm-hmm. And Shedrack, as we round off, what will be your message to government?
Well, I just want to appeal to the government to give us more support so that we can push cycling to higher heights. Because if we have enough support, we'll bring so many laurels for this country. Yeah. I'm sitting here, I'm getting some laurels in cycling for Sierra Leone, yeah, internationally. So more support, we can do more.
Support in technical or funding?
Funding. Just funding. Funding is our problem because the technical know-how, we know how to do it. Yeah.
All right. And thank you very much. He's Shedrack Williams, Technical Director, Sierra Leone National Cycling Association, and also we've been talking to Tennis in Dixon, a cyclist. They've been my guests on the second segment of Wake Up Sierra Leone. And I'm afraid this is where we have to end the show for today's edition of Wake Up Sierra Leone. But as always, we want to say thanks to our sponsor, Local Commercial Bank, for their support to the program. And to our audience, we appreciate your time, we appreciate your comment. Stay tuned throughout the day to AYV as we have other exciting programs coming up. Till we meet again for another interesting edition of Wake Up Sierra Leone, I am Bokari Matia. Do take care of yourself.